agendas in the back. That's not our agendas. If you could.
The website for the agenda.
Did you have copies printed out?
I don't think they copied the copies out.
That was an oversight. Are you starting right this minute?
We did start, and then public comment began. So. Okay, so on I'll verbally say the agenda now for your understanding. We're going to be calling the meeting to order. We have the chair announcements. We have public comment on agenda items. We have approval of the previous minutes. We have board updates, which include a review of the Pennsylvania Department of Health presentation and COVID response updates. And then at that time, there's public comment. That's our agenda for today. Okay? All right. So at this time, is there any public comment on the agenda items that I just read out? Okay, thank you. All right, and at this time, I'm going to ask for the approval of the minutes that was presented to the board.
Call for I approve the minutes from last time.
Motion to approve. I just need a second.
Second.
That was Anne Marie, seconded. And just for everyone's awareness, because of the current situation with COVID, we are doing a hybrid meeting. So 2 of us are here in person and 2 are virtually today. Thank you. Okay, so we have a motion to approve the minutes and seconded. All in favor?
Aye. Aye.
Okay, the minutes have been approved. And at this time, we're going to have the board updates with the review of the Pennsylvania Department of Health presentation and the status of approval. I will be giving the status of approval, but right now we have Grace Gorenflow, the consultant for the county, to do the presentation on the Pennsylvania Department of Health. And Grace, are you on the line?
I am on the line. Can you all hear me?
Yes, we can.
Okay, great. And are my slides showing?
Yes.
Yes, they are. Mm-hmm.
Perfect. Okay. Well, nice to see everybody. Good evening. On December 9th, Dr. Taylor, Rosemary Hall, and the incoming health director, Melissa Lyon, gave a presentation to the Pennsylvania Department of Health. And the purpose of the presentation was to let them know where we are and what our plans are moving forward. So I will go ahead and review that with you now. We started off, as you can see, sorry about that, with the overview. We reviewed, and we'll go through this, but the plan was to go over the guiding frameworks for the health department, review what has been accomplished so far, share with them our staffing pattern, go through the required programs as well as additional programs that we will be providing right out of the gate, and then also describe how we plan to develop and evolve over time. I think you all are very familiar with this particular graphic at this point. We talked about Public Health 3.0 and the foundational public health services as the bases for how we are framing the health department, both in an operational sense and a philosophical sense. And yeah, those 2. All right. We also talked about our Public Health Steering Committee and the work that the steering committee had done. Know if we ever presented this kind of a slide to the Board of Health before. So I'll take this opportunity to point out that we had great representation from several different sectors. So you can see the first group up there is the healthcare sector. From academia, we had somebody from Drexel University, community organizations. We had somebody from the Foundation for Delco. We had our state senator represented on there. We also worked with specific parts of the county government. And then also we had municipal representation from 2 different municipalities because that connection obviously is very important for several reasons. And as you all know, the Public Health Steering Committee was overseeing the establishment of the health department up, and actually they were seeing all of this until we had completed our program plans. And now, of course, the Board of Health is the one that is overseeing the final application process. Quick refresher here for you all. The vision, mission, and values of the Public Health Department. If you look at the bottom under values, you see that equity is the first one. And equity is really woven into, carefully and deliberately woven into the vision and into the mission. The vision, mission, and values all reflect the principles of Public Health 3.0 and also position us nicely to fulfill all of the responsibilities in the Foundational Public Health Services framework. These are the 4 strategic goals, and this is how we presented the work to date. So you remember that we've been holding meetings, we're continuing to hold meetings with the Department of Health as we wrap up the application itself. And we did some advocacy or some education around Act 315 and increasing appropriations for that. In terms of generating public support, the Mendoza Group has been hard at work with a communications campaign that that will help inform the public about the health department and the fact that it's out there and what people can expect from the health department. In terms of engaging key stakeholders in the initial planning, as you recall, we held 25 listening sessions where we gathered input from all corners of the county with a number of different public and private and nonprofit organizations. And then finally, in terms of establishing the health department programs, we have finished our series of think tanks that were geared around all of the different program areas. And we have developed program plans as well as a number of policies and procedures. We also talked about you all. So we shared with them the list of our Board of Health members and talked about the wealth of experience and expertise that you all represent, as well as each individual's commitment to health equity. And then we went on and shared with them some data that our epidemiologist, Dr. Rulon, pulled together for us. So you can see here, this is an updated chart, and it shows the 15 leading causes of death from the year 2019, and it's divided by race. And so the white population is on the left, the Black population is on the right. And you can see that assault still is way up there on the right. I guess that's that's something obscuring my screen. And we also can see that diabetes is higher, among the Black population than the white population, and that's not surprising. And again, this is just one way of understanding how health issues and health problems affect different segments of our community. Dr. Rulon also put together this chart that goes into more depth about health inequities in Delaware County. And remember that inequities are differences among population groups, differences in health that are avoidable. It's important to remember that these can all be, these kinds of differences can be prevented. And so that's going to be an important focus of the health department moving forward. Now, even though you can see differences between race and ethnicity throughout, the numbers that are in red show statistically significantly higher rates of various conditions. These are rates that are higher than elsewhere in Pennsylvania. And in the blue text, these are rates that are statistically significantly lower than the Pennsylvania average. So we've got some of those as well. Dr. Rulon also provided us with an update on, as you can see, the mortality rates from COVID, broken down by race, as well as the vaccination rates among different races. And again, we see the same kinds of inequities in terms of mortality, which is not surprising because health status overall is lower among non-white populations. All right, so then we moved on to staffing, and here is the staffing, the organizational chart. I cannot remember if you all saw a chart before this one, even if that is the case. There's really nothing different on here. A couple of things are organized a little bit differently, but we haven't made any changes in terms of positions or functions. That's stayed the same. We also provided a staffing update in terms of filling the positions. And this is blank because we kept changing things because the staffing update changes all the time because we continue to bring people on board. What I can tell you in terms of the staffing update at this point is that we are set to go. We really need one more nurse in order to have a critical mass of staff in order to do what we need to do. And recruitment efforts are underway. And as I said, we keep bringing people on all the time. So at this point, we switched and we talked about the activities and the benchmarks for each of the different program areas. And I'm going to tell you that on the right, even though it says benchmarks for 2022, these are really benchmarks for June 30th of 2022, because the state, as I'm sure you know, operates on a July fiscal year. And so we're asked to plan according to their fiscal year, because that's when our Act 315 grant is renewed, will be in July. So we went through and talked about the various services, really highlighting those that are not required by Act 315. And I can tell you that having an Office of Health Equity is not required by Act 315. However, it's really important to have this office in order to operationalize the values and assist in meeting our vision and our mission. And so you can see here in terms of services that this office will be working both internally with staff and externally with community members and community organizations. When it comes to administrative support, pretty much everything on here, yes, everything on the left is a requirement, even if it's not specified directly in Act 315. We really need these positions in order to fulfill those functions. The only exception to that is our goal in the future for having a grant writer to help bring resources not only into the health department, but also to help bring health-related resources or resources that will improve conditions in which everyone can achieve their optimal health, bring those resources into the community. In personal health, I'll just remind you all the various things that we're required to provide. So under communicable disease control, that covers programs in HIV, sexually transmitted diseases, and tuberculosis prevention. It includes case management to make sure that infants born to mothers who have perinatal hepatitis B receive the series of vaccines, and also to serve as a provider of last resort for immunizations, both for children and for adults. The next item on there is vaccines for children. The VFC, Vaccines for Children program, is a federal program that provides childhood vaccines to providers. And not only will the health department be getting the vaccines themselves, the health department also is deputized by the state to go out and conduct compliance checks and audits with all of the other providers in the county who also participate in the VFC program. We also have a school health liaison. This is a position that is not required by Act 315, but we heard loud and clear during our listening sessions that the school districts really need a liaison in the health department who can help them with a number of things. Of course, this has been an issue through the pandemic, even though we don't have a health department right now. And so our work is different than what it will be once we've launched a health department. But there are all kinds of other issues that schools really would like assistance with. We are required to provide maternal and child health services, and we've decided, based on data and also based on talking on conversations through our listening sessions, that we will work with partners to expand doulas, the number of doulas who serve women in the county. And we also are looking to establish a Hello Baby program. These programs, another name for them is Baby's First Touch. This program will be designed to touch every mother who gives birth in the county. So this is not tailored to any kind of need or means test or anything like that. Every mother will be contacted through the Hello Baby program to make sure that she is aware of all the resources that are available and to help connect her with any resources that she needs. A couple more things that come under personal health include case management for children who have lead poisoning, as well as following up on animal bites. So that is the smattering of services here. You'll see that on the right, in terms of benchmarks, we're seeking to ensure that that our staff, as part of their job, establishes relationships with community members and with community organizations, and also that after the first 6 months of operation, that we have established and institutionalized ways to make sure that we work with the community and the community voice is heard when it comes to how our programs are implemented. All right, so moving on to population health, of course, first and foremost, emergency preparedness. And right now, this means really pandemic response. So same kind of work is going on in pandemic response that we prepare for if there's not a pandemic. So even though the emphasis now is on response, we will gradually evolve into more of a preparedness role where we're conducting drills and that kind of thing. overtaken by events right now, the pandemic. We are also responsible for disease and health surveillance. And so this means that not only are we watching what's happening with communicable disease, but we're also watching what's happening with the major causes of death, illness, and injury, because that will drive what we do with that final bullet on here in terms of health promotion and wellness. When you look at benchmarks, you will see that we've talked about having comprehensive data collection for a community health needs assessment. A community health needs assessment process by definition includes a lot of community input and work with the community, and that won't happen between now and June, but the data collection, getting data together, has already started. So we will be making some really good headway with that. And then also you can see another bullet point about engaging the community members. This is not only as part of the community health needs assessment, but also this is the Bureau that will be working on other conditions related to health. So for example, violence, food insecurity, housing, those kinds of things. And so of course it's going to be really important to really get in there with the community and work with them to identify solutions. Environmental health, the inspections are all required, that the county health department do them. These are state requirements. In addition to the inspections, we're responsible for vector control, and we see that through our West Nile virus program, which has been underway at the health department for several years, and the same staff member who has been doing that as a staff member of intercommunity health is staying on with the health department. In the future, we'll offer food safety courses. This is a great way to reach out to the community and help ensure that all kinds of gatherings where food is served are that much safer. Okay. Last two slides, and I think these probably look very familiar to you all. We shared with them our focus for each of the phases, starting with our developmental phase, phase 1, getting everything up and running and established in terms of Act 315, and then moving into and expanding further than that in phase 2 as time and resources permit, to add programs and otherwise meet national standards that we need to have in our community, but that are not necessarily required by Act 315. And then that third phase is the accreditation process and moving into the future. And again, when we look at this from programs and services perspective, you will see under phase 1, these are all the Act 315 where we see ourselves headed as we expand. And then again, when we think of programs and services, further expansion in phase 3 to continue to achieve, to work towards our vision and to achieve our mission. All right. Any questions? I'm sorry, I didn't even stop along the way, but now that you've seen everything, hopefully a lot of this is very familiar. And do you have any questions for me?
And Grace, this would be directed to the Board of Health. So does any members of the Board of Health have questions for Grace? All right. Well, thank you so much, Grace, for that presentation. And so I'm going to review just where we're at right now. So we did present, as Grace said, that was the initial presentation that we gave to the Pennsylvania Department of Health. And we are working with them on the final approval process, and we're looking forward to hearing from them soon. We did ask for a date, but we do not have that as of yet, but it is in process. All right, and right now I'm going to give some COVID updates, and it's not looking too good. So from December 23rd to December 29th, we had 5,721 cases of COVID detected through PCR testing. From December 30th to January 5th, that number has doubled to 9,578 cases.
Sorry, I can't hear you.
Can you hear me now?
Yeah, thank you.
Okay, so I'll say those numbers again. December 23rd to December 29th, we had 5,721 cases detected by PCR. From December 30th to January 5th, that number doubled to 9,578 cases. Our positivity rate as of 12/31 was 28%. So we are very concerned about the current status of COVID. Our numbers in Delaware County are significantly higher than Montgomery County, Chester County, and even Philadelphia. Today, we had a press conference with the Secretary of Health at Mercy Fitzgerald, where the AMI testing site was opened up. We ran testing also at the city of Chester today, doing close to 500 tests at that facility. And other testing facilities are being run across the county by private healthcare entities. The COVID response team has been working very, very hard to set up additional vaccination sites, which are listed on our website. We continue to vaccinate and booster the community, and we are doing those at our Keystone Wellness Center in the city of Chester, as well as our Yaden site wellness center. And we also have our additional testing that's being done at the 69th Street Terminal and vaccination. We continue to serve the needs of the community, and we will be working with community members and doing individual vaccine clinics as needed in the community. And I also want to point out something that we are also very concerned about is the Delco COVID cases in school-age children is also trending, with cases in school-age children 5 to 18 years of age from 12/22 to 12/28 being 937 through PCR testing, with total cases since August 16th being 4,671. This last week of December is accounting for 20% of the total cases since August. So the Omicron variant is really, really taking hold in our communities. It's overwhelming our emergency rooms and hospitals right now. The emergency rooms are frequently on divert in Delaware County over the last 2 weeks, and we're working with our emergency rooms, helping them with the Medical Reserve Corps and Citizen Corps. We also anticipate other testing sites opening up in the county, and we are working to ensure the safety of our staff during this very contagious period. Surrounding counties have adopted CDC and Pennsylvania Department of Health mitigation recommendations that during high or substantial transmission, everyone should wear a mask in public indoor settings, which includes schools and workplaces. And we strongly encourage people to do that at this time. So at this time, I'm going to ask if there's any questions from the Board of Health on the COVID updates. PJ and Anne-Marie, you good?
I just, given how challenging it's been to keep up with the testing with PCR, I'm wondering if we think we're, of course, undercounting because of the number of people who are now accessing, the at-home testing. And so the numbers are actually far higher, I imagine, than we're able to track.
Yes, we think that the numbers are significantly higher because of the number of at-home rapid antigen tests being done. But we still encourage, if you do use a rapid antigen test, that you make sure that you're following the CDC guidance on isolation and quarantine. But yes, we anticipate that the PCR numbers are probably a fraction of the number of people that are infected at this time.
I expect that the numbers are probably multiples of perhaps 3 to 5 times as high as what we've just heard in the PCR report.
I have a question. I believe some of these test sites also do antigen testing, rapid antigen testing as well. Is that counted on the PCR testing numbers that you just presented, Rosemary?
So if a site does the rapid antigen testing and the PCR. It's, if they do both at the same time, then it's only the PCR. And for all of the numbers that we do for percent positivity, we don't calculate this. The Pennsylvania Department of Health calculates these numbers, and they are only using PCR numbers at this time.
So, Rosemary, you strongly encouraged masking and other mitigation factors. The Board of Health at this point is not in the position of being able to make official recommendations. Is that correct?
That's correct. Until we are finally approved by the Pennsylvania Department of Health as a health department, the Board of Health would not be able to make any any other guidance other than strongly recommending people to do these.
Yeah. But I just want to endorse what you said. The entire ecosystem of the county is under strain. There's lots of test positivity in schools, and the provider healthcare system is under enormous strain with high numbers of patients hospitalized. And a particular problem is the staffing shortages that have only been exacerbated by the current wave of the pandemic. So it's important for the board, I think, to signal its intentions in this. We really strongly recommend this, although we can't take an official position at this time.
Thanks, PJ. Lily, anything else?
I have any comments on the vaccination at this time?
On recommending vaccination?
Yeah, do you have these statistics on the numbers of vaccinations that we have provided in the county?
Yes. So as a county, we have provided close to 157,000 vaccines as the county. Other entities have provided vaccines, and we estimate that we're close to 70% of the county vaccinated who are eligible between the ages of 5 and above. I would note that the hospitals, we particularly were talking with the Secretary of Health at the Mercy Fitzgerald Hospital today, and the hospitals have noted, all of the county hospitals have noted that the majority of people that are hospitalized right now are unvaccinated, that the people that are dying are unvaccinated. And we've had several deaths this week in the county of people who are fairly young, particularly a 36-year-old man who died and has 2 young children.
So I think what we're saying is vaccination as well as masking.
Rosemary, is there any plan? I know that we're overwhelmed with COVID right now, but to track ultimately the impact of the county on delayed care for other conditions and missed vaccinations for other conditions. And I know, at the high point in COVID in New York City, people were not going to the emergency department when they should have, and stroke and heart attack and things like that. Are there plans to track those kind of side effects of overwhelming the health system right now?
So that's up to the individual hospitals right now, and maybe Dr. Brennan could comment on that.
I'm sorry, could you repeat that, Emery?
Sure, Dr. Brennan, I was asking about kind of how the hospitals are tracking the impact of, being kind of at capacity and delays in care for conditions other than COVID, so delays in attending to, cardiovascular events, things like that.
Yeah, most of the hospitals in the region, I think, are in the position of having to make case-by-case decisions about which patients can be delayed for certain types of procedures. And I know in our case, what we're considering is whether a procedure can be delayed for 30 days without harm. And if, in the opinion of the surgeon or the person performing the procedure, that can be done, then we will postpone the procedure. And I think others are using similar types of criteria. Those patients are all being tracked to be rescheduled. I think, there are probably going to be papers written for, a decade or more to come about the impacts of these sorts of delays. I mean, we know from last year, in 2020 and 2021, that there were enormous delays in cancer screenings, for example. Colonoscopies dropped dramatically, mammographies dropped dramatically. And that's the impact of having the system overrun with COVID patients and not being able to deal with other issues of important population health, and the impact on the staff of having COVID or being exposed to COVID, mostly in the community, because they're protected in the healthcare workplace, but most of the exposures are occurring in the community, and then they're out either in quarantine or isolation, and all of the hospitals are stretched for staff.
Thank you.
Okay, and at this time, do we have any comments from our Board of Health other than our COVID response update? Okay.
I don't have anything, Rosemary.
Okay, thank you. And just to reiterate, so the Board of Health supports recommendations of the Pennsylvania Department of Health and notes scientific studies support the mask wearing significantly reduces risk of infection and spreading of disease. The Board of Health intends the future would lean strongly to similar recommendations of the CDC and surrounding counties of Montgomery County Office of Public Health, which strongly encourages schools to continue to require mask wearing. I would ask the board members right now to just verify that we are in agreement of that statement.
Yes, I am in agreement that mask wearing should be encouraged in school settings, especially in this high rate of COVID-19 that we're seeing right now and how transmissible this virus is currently.
I am as well, Rosemary, and I just want to add to what you said and say that it's not just any mask, but it has to be an appropriate mask, and it has to be a mask that fits well. So wearing a surgical mask down around your mouth or your neck, or wearing a surgical mask that has gaps that you can breathe around is not an effective mask. The mask has to fit well. KN95s fit better than surgical masks and are more effective than surgical masks, and N95s most of all, although they're not necessary for protection in public places. But cloth masks that do not have filter inserts and gaiters are not effective forms of protection. So it really needs to be a proper fitting mask and an appropriate mask. And I endorse masking in indoor settings and in schools as well.
This is Anne Marie. I agree with everything that's been said. I support masking in schools and indoor public places.
Thank you. So at this time, if there's no other comment from our Board of Health members, we will open it up for public comment. I will just say, and I'll let John Lichtenstein begin.
Actually, I don't know if you saw the emails that were going around prior to this. I just wanted to give a brief update from the solicitor's office. We wanted to inform the board that very late this afternoon, a application for a preliminary injunction was filed by the townships of Springfield, Ridley, Upper Chichester, Aston, Tinicum, Darby, and Marple, asking for a delay in the implementation of the environmental health inspections by the board until January of 2023. The reason given was their belief that the Board of Health is not in a position to take those over and that they would like to keep doing them. And the county intends to defend this vigorously. We're just digesting it. I don't really have anything more to tell you about it at this time, but if board members have questions, please reach out to the solicitor's office and we'll be happy to discuss.
Okay, thank you, John.
Also for public comment, would you like me, as the solicitor does for board meetings, to time people for 5 minutes, which is the usual limit?
Yes.
Okay, and I'll give people a 1 minute warning.
Okay, thank
Great,
you.
thank you.
Okay, so at this time, we'd like to open it up for public comment. We ask you, as the solicitor just said, to keep your comments to 5 minutes. Please come up and give your name, address for the record.
Hi, I'm Linda Batiste. I live at 33 Beach Avenue in Alden, Pennsylvania. I've lived in Delaware County my entire life. I'm 56 years old. A couple of things. I would encourage the board, even Fauci is now saying that the infection rate is not what we should be focusing on. We should be focusing on hospitalizations and deaths. While I heard you say that the hospitals are overwhelmed, and that a person who's sick. We did not actually hear data. We heard data on the infection rate. Thank you, 28%. I did not hear any data on the hospitalization death rate. More importantly, I heard you talk about vaccines. Sounds like there's going to be two departments overseeing that, the Bureau of Personal Health and Population Health. That's a tremendous concern that I have, is that there's no discussion of early treatment. There's no discussion of the repression of early treatment. I am a COVID survivor. I went into the Springfield Hospital emergency room and was told that there was nothing they could do for me. I had double pneumonia. Had I not told them that I had been diagnosed with COVID, I would have been sent home with treatment for pneumonia. I was sent home with nothing. I was told that I could either go into the hospital and get remdesivir, that she had no protocols and was not allowed to give me any treatment. You want to know why people are dying? That's why people are dying. I was sent home to smother, okay? Luckily, I had access to other things, okay? And that's why I'm still standing here, okay? I would like to know what you're going to do about that. I would like to know why early treatment is being repressed at a hospital in this county, why I was not offered some kind of corticosteroid, something to relieve my pain or to help me with my pneumonia. I wasn't even given suggestions about what I could do. I have a real problem with that, and I would like I'm so glad that you're here. I'm so glad that we're going to have our own health department and not have to rely on Chester County, but I want to know what you're going to do about that. I would like to know what you're going to do about the VAERS reporting system. The Vaccine Adverse Event Reporting System has 1 million reports in it, many by doctors who have to put in an injury number, okay? Usually 30 to 50 vaccines are stopped. We're at 1 million. We're in the range of 1 million, either injuries, deaths, hospitalizations. I haven't heard one word about concern about that. What is my health department in Delaware County going to do to follow up about that and provide me with the opportunity as a citizen to be well informed about the risk-benefit analysis to myself based on my health, my history, my comorbidities, based on the efficacy of this vaccine, which is highly questionable, okay, and the risk to my health, okay. Our children are not being affected significantly by this COVID-19. They are being infected. That does not mean they get the disease, okay. I would like to know what my Department of Health is going to do to protect my health freedom, to look into these injuries. I don't see it on the news. I don't see anybody talking about it. I haven't heard one word about it from the board tonight. I've heard, we got to make sure everybody gets vaccinated, but nothing about the injuries, what's going to be done for those people. How are those people going to be tracked? What's going to be done for them? What is this board going to do for them? And how are you going to protect me? And how are you going to protect my right to choose? That's the kind of stuff I want to hear you talking about.
Hey, thank you so much. And I will just say we take all that under consideration. And once again, we are not officially approved as a health department at this time. And we will take your comments under consideration. Thank you. Anyone else for public comment?
Hi, Bill McIntyre, 215 Cherry Hill Lane, Broomall, Pennsylvania. One of the first charts you had up there had all the different deaths listed across the county, broken out by race and whatnot. One of the things that jumped out at me was that you had listed homicides under a health issue. Normally, I would think homicides and how they would be dealt with would be something under the law enforcement, judicial system, or legislature trying to come up with a need. Was this homicide there because of, when you listen to all the multiple commercials you have on pharmaceuticals, they list the adverse effects. And some of the adverse effects for people suffering from depression are depression, suicidal thoughts, so on and so forth. Is that one of the areas that you're talking about health being involved in homicides, or is it working with the other departments, law enforcement or stuff like that? It just seemed like it was kind of out of place. Homicide isn't a disease. It's an event, a violent event. So, but if it's because of a health issue, something prescribed, I can understand that. So that was something so if you have an answer for that, I'd be curious. Thanks.
So I can just say that homicides are tracked by the Pennsylvania Department of Health. There's a list of reportable diseases and other items that we also track. And so that is a standard thing in public health that we actually track. And so one of the things that they do look at is depression and gun violence and those types of things to address the needs of the community and try to work with other partners to address. Okay.
Hello, David Fay, 47 Waverly Road in Havertown. I would like to know why you're still using the data from the PCR tests, which have been discontinued by the CDC due to them not being able to tell the difference between the flu and COVID. Why are you still using that? There's some reason for that. The 30s unvaccinated man that died, was he unvaccinated or was he not up to date on these vaccines? Because they keep changing that as well. Where and what are the studies for the masks that these people are talking about? N95 mask doesn't stop a virus, not at all. It's not even possible. You would need to wear a whole suit. That's what they wear in the biolab. That's how you stop a virus. And that's about it for me. And children. What is it that children are getting infected with? If the PCR doesn't work, then how are you telling that it's COVID? You're just making up stuff. So please stop making up stuff. That's all I have to say. Thank you.
Okay, thank you. Okay, if there's no further. Okay.
Oh, there are two. From, oh, I'm sorry, she does not give her full address, so we don't read those. This is from Mary Austin, 1036 First Avenue, Media, PA, 19063. Hello, my comment is that we have documented serious concerns about the medical care of people at the George W. Hill Prison. There was a woman who had a miscarriage and was not seen until 2 days after her complaint of bleeding. We are also aware that it's taking a long time for people to be seen with injuries. Also, we have been told that COVID testing is only being done on those people who are leaving and not people who are coming into the facility. Is it the responsibility of the county health board to ensure these citizens get adequate medical care? And let me just double check. No, there's not an address on this one.
Okay,
Thank you.
thank you.
Alexia McKnight at 258 Hayburn Road in Chadds Ford. And I am here as a resident interested in helping you with a big problem with the wireless industry. I'm not sure if you're aware. A lot of the proliferation of wireless towers everywhere has frequently been called safe based on FCC standards. But that all changed in August from a big lawsuit where it was found that those standards were not founded on anything valid. And to date, now they actually aren't any safety standards. There are, however, at least 6,100 studies that I'm aware of that show harm from pulsed microwave radiation. Our US ambassadors that have fell to Havana syndrome is something that is in the public eye quite extensively, but those ambassadors aren't the only ones injured by pulsed microwave radiation. Many citizens, I am one of them. I've been tied up in the courts for several years, as have several hundred other Pennsylvanians. when utilities or telecom install antennas everywhere, even when fighting back. A case example is in Conshohocken recently. There was a lawsuit against AT&T because they wanted to install a tower right there in the densely populated residential area. And the township won the lawsuit, but AT&T went ahead and installed that tower anyway, citing Act 50, which was a recent law passed. From introducing the bill to being passed into law was upwards of a week. Telecom essentially overruled any ability of local authorities to say no. For whatever reason, they don't want these towers. The FCC lawsuit that was also lost, showing that the safety standards were questionable at best, and the many thousands of studies showing harm from this microwave pulse radiation coming from 4G towers, 5G towers, wireless devices. This radiation is quite significant. I'm a veterinary radiologist experienced in the damage of ionizing radiation. And the damage from non-ionizing radiation was not taught to us as a profession. I had to find out about this the hard way. And in this plight, I have met thousands of people that are severely injured. Many people have not yet made the connection between their health conditions and the cause. I'm hoping that our Delaware County Health Department might be able to help us in this fight against the telecommunications industry and utilities that are dead set on installing these antennas. And in many cases, they're just feet from a child's bedroom window. And the intensity of that radiation is quite damaging. It's been shown extensively. The documentation in the medical literature is overwhelming. There's 4 to 5 day continuing education courses for physicians to learn about this problem. This is nothing new. It's just that the evidence is being ignored and damage is being denied, and the proliferation of these antennas continues and continues. So I'm hoping you'll be able to help us, and if you had any comments on what I might be able to do to help you, help us. We're not the only ones involved, your constituents, but you yourselves, your loved ones are also damaged by this technology. There are safer options, and I would like to roll those out instead.
Thank you.
Hi, my name's Sarah Fahey. I'm at 47 Waverly Road, Havertown, Pennsylvania. I just had a couple of questions. There's been a lot of anticipation about the Delaware County Health Department opening. And I know a lot of the school districts are under the impression, and I know Dr. Brennan specifically is in contact with a lot of the superintendents in Delaware County. And I know the school districts, because I've been to some of the board meetings, they're under the impression that you guys are going to be giving them local data, basically starting in January. So if that is not the case, if that could be communicated, because I know you're not technically up and running at this point. So, but I know that there's a lot of school districts that are under the impression that they're going to be getting local coronavirus case numbers from the Delaware County Health Department starting like now. The other thing I wanted to talk about is, I have a child. I'm just really very concerned about the mitigation efforts and the effects that they're having to kids. CHOP is filling up with children with mental health issues. Kids are really struggling. Kids are getting depressed. We're seeing developmental delays in young children. I know somebody that I spoke to recently has a 3-year-old, and their 3-year-old is not speaking, And when they took them to the pediatrician, they said, we are seeing lots of kids this age that are not speaking. It's from the lockdown. I mean, this should be, red flags should be going up in people's heads. Dr. Brennan also said that the cloth masks are not effective, but yet we're requiring those in the schools. Kids can't, I mean, the kids that are ESL kids, English is a second language. I mean, those kids are losing education based on this idea that these cloth masks are doing something. So again, I'm just really concerned about what this is doing to the kids. The kids are not winding up really sick in the hospitals. They're getting very mild cold-like symptoms, but they're really taking, they're having major developmental delays. I mean, I think as a health department, you should be concerned about this. I mean, how many years are we going to be doing this to children? We have a vaccine available now. I mean, I really like the woman that spoke earlier and talked about why are treatments not being offered? I mean, we have treatments. So when this pandemic first started, we were supposed to flatten the curve when we had nothing available. And now 2 years later, we have a vaccine, we have all these treatments. And yet we're still, forcing people into these 10-day quarantines. I mean, I really think that we need to really start to look at the long-term effects of what we're doing here. And as a health department, I do think that's your responsibility. I'm also really disappointed that there really wasn't a lot of information about nutrition. I know during this pandemic, my family and we've been very focused on nutrition. I don't see the CDC, I don't see the Pennsylvania Health Department. Hopefully you guys will. I mean, please start talking. These kids, they're being locked down. They're being kept inside for months. They're low on vitamin D. I mean, these kids need adequate vitamin D levels. Forget testing for coronavirus, test vitamin D levels. That's how you're going to keep the kids out of the hospitals. Vitamin C, zinc. Nutrition is extremely important if you want to keep people from getting sick, yet it's not being talked about at all. All that matters is the vaccine, which is fine. I have nothing against the vaccine. But why are we not ever talking about nutrition? Why are we not seeing posters telling people, make sure you're supplementing with vitamin D? Make sure that you're eating healthy vegetables. Make sure you're getting outside. Make sure you're actually letting oxygen into your lungs. I mean, that's really important. And, I think we need to start really looking at overall health and not just pharmaceutical products, because we've been doing that for 2 years. And at this point, we need to change the strategy here. And again, I don't know why you're using that PCR test. I mean, they're reporting on the news that the PCR test is too sensitive and it can't pick up different viruses. So they're reporting that on the news, and then we're getting this report on the PCR test. So again, I don't even know how accurate those numbers that you have are, if those are even coronavirus cases or they're flu or RSV or some other virus. So again, I'm just hoping, I'm glad that we have a health department now, and I'm hoping that we can see some changes, because if it's just, you're just going to be regurgitating what the Pennsylvania Health Department says, that's not what we really need at this point. We need something more local, and we need something that actually works. And I would like to see it be really focused around nutrition. And thank you. Thank you for your time.
Thank you.
Hello, good evening. Welcome. I'm so glad we do have a health department. My name is Helene Conroy Smith. I live at 32 East Westwood Park Drive in Havertown. I'm coming up today because I am concerned that we are requiring masks for our children in schools without looking at the efficacy of masking our kids. I will say that I do follow the PA state site, and what it said as of 12/21, 758 children, tested positive in the schools, the K-12 schools. 69,827 tests were applied in the schools to the kids. So that means 1% of our K-12 population has had COVID since they began the Test to Stay program in our schools. So what I'm looking at is, what are we doing with all this testing, with all this masking, with all these things we're recommending, and yet are we really looking at the data? Because it's the data that matters. The data is what should be driving what we're doing. Children are struggling, children are depressed, our hospitals are overrun right now with kids with mental health issues because of the lockdown. We are seeing that. We have kids that have significantly regressed academically because of the lockdowns. These are things that we need to look at. These are health issues. These are mental health issues. And I'm asking you, please, to keep looking at the health, not at what is being spewed, the propaganda being spewed out. Thank you.
Thank you.
I'm not here to talk about COVID or anything like that. Can I speak now or do I gotta wait?
No, you can speak. Just come up to the microphone and give your name.
My name is Freddie Lesher. I live at 118 Main Street in Cowin. I'm head of the Delco Coalition for Justice. And what I do want to do is I want to thank the past council because we were the first people to bring up the private prison issue. I want to thank council for their movement to close down the private prison, to take the profit incentive that the past administration had to fill the prison, which was the one set money to the prison company so they could put 3,000 people in there. And I want to thank the council for moving in the right direction. But there's other issues surrounding that prison. One of them is the system that the past administration had for over 20 years. And I don't know why it took 20 years for anybody to bring this issue up to fill the prison, which was to go around and set these kids up for next to nothing, throw the book at them, and every kid.
So I just wanted.
Oh, that's what I was. That's why I asked if
Okay,
I could speak.
I thought you.
This is not a county council meeting.
This is not a county council meeting.
Oh, what's a county council? I thought it was.
But appreciate your efforts. Thank you.
Wednesday, I'll be here.
Okay, thank you.
Hi, my name's Angela Walker, Hamilton Road, Bryn Mawr. I'll just take in just a few things that come up. Mostly, what worries me are all these key words of operationalize, compliance, surveillance. It's all a little bit scary. I want to know what are you going to do for health freedom? What are we going to do for freedom of choice? And there are a lot of people who would like to have their private health decisions kept private. A lot of the data, a lot of everything is officialdom. And I just want to present you with this book, The Real Anthony Fauci by Robert F. Kennedy Jr., just so that you're all on the record made aware of the information in this book. And hopefully you'll all read it and we can have some real talk about some real changes for health. So I'll leave it there.
Okay, thank you. I'm checking with the solicitor to see if there's any other public comments from the email.
No other public comment. Yeah. Are there people here who'd like to public comment?
Just briefly, a lot of this was said before. My name's Patty McIntyre. On Cherry Hill Lane in Broomall. And it's kind of along the same lines of medical freedom. We hear a lot about mandates in the news, and it just freaks me out because one size doesn't fit all. And I've been for over 20 years doing my own kind of medicine. I don't use pharmaceuticals unless I really have to. That's my last choice. So I want to know how my rights are going to be upheld. That's my biggest issue. And anybody like me who has their own way of doing things, I just feel like we need to have our rights. We have constitutional rights to do certain things, and I just don't think mandates are the way to go. So, thank you.
Thank you. Okay, at this time, is there any other public comments? Okay, at this time, I know that a couple of the board members wanted to also have the opportunity to make final comments for the evening.
Rosemary, if I could just comment on the issue of the data at the school district level. I've continued to meet with the superintendents on a regular basis, and as you know, since Chester County stopped providing support over the summer to Delaware County, the district level data hasn't been available to the superintendents, and they've really missed that and have been looking forward to receiving it again. As you know, and I hope the members of the public present know, the county has not had access to that data from the Pennsylvania Department of Health, but will as soon as we are fully constituted as a health department. And what I've been telling the superintendents that is just as soon as we have those data, we will share it with the superintendents as soon as we can reconstitute it in a format that is useful to them. And I've had conversations with our epidemiologist, Dr. Rulan, about that, and hopefully we'll be able to have that soon. But since we're not official yet, we don't have the data and we can't provide it.
Thanks, PJ. Any other board members have a comment? Okay, thank you. And I just want to thank everyone for coming out tonight. And we do take your information under consideration, and I appreciate your time and energy in voicing your opinion. So thank you. At this time, I'm going to adjourn our meeting. Our next meeting is March 3rd, 2022, and I'm just going to ask for a motion to adjourn.
So moved.
Okay. We're officially adjourned.